The budget session starts today, February 9th. I am going to head down to Cheyenne shortly, and I will be there for the duration of the session, and I will be providing you with updates throughout. But today, there are over 100 bills slated for introduction that will be voted on extremely quickly. It pertains to repro, there are several bills that we are concerned about. 2 of them just dropped over the weekend, and so now is the time to reach out to your legislators before 2 p.m. today and let them know whether you want them to vote yes or no on bills for introduction. So the first that I wanted to cover was HB 3. We've gone over this several times. It protects unregulated pregnancy centers from regulation and oversight and allows them to continue peddling and advertising for untested medical treatments like abortion pill reversal, which could be extremely dangerous. Secondly, just dropped over the weekend was HB 117, and they are calling this Stop Harm, Empower Women with Informed Notices. And basically this bill highlights a statistic which states that 60% of women who had abortions experienced outside pressure and implies that this is somehow evidence that most women who seek abortion care are coerced. This is absolutely false. The Turnaway study, which was extremely extensive, conducted by the University of California at San Francisco, found that 95% of women surveyed 5 years after the fact did not regret their decision. And the predominant emotion that they reported was relief after having received an abortion. And while many women struggle to make the initial decision around abortion and may face some pressures, both financially or from family or their social network, and face stigma around that, that does not mean that they are coerced into making that decision. This bill also allows patients to seek damages from providers of abortion care. Doctors are already required to seek informed consent from patients. This is completely unnecessary, and it would threaten providers with fear of lawsuit for providing basic care. So again, would just be driving OBGYNs out of the state. This bill is also just in no way empowering to women. In fact, it interferes with the patient-doctor relationship and treats women as if they cannot take responsibility for their own decisions. It's completely patronizing. Finally, there is the Human Heartbeat Act that has come up, HB 126. Basically, this bill is another attempt at a full abortion ban. The state in it inserts its interest in protecting fetuses from experiencing pain, which it claims occurs after 15 weeks. Again, this is completely false. According to the American College of Obstetricians and Gynecologists, fetuses do not have the capacity to experience pain until after 24 to 25 weeks, and the current viability limit for abortion in Wyoming is 24 weeks. This bill prohibits abortion when a fetal heartbeat is detectable, which is often just electrical impulses like flickering within the fetus. In other states, we've seen similar heartbeat bills like this. That is basically limited abortion to 6 weeks when those rhythmical electrical impulses are detectable via transvaginal ultrasound. So this would also require forced transvaginal ultrasounds, and a lot of folks don't even know they're pregnant at 6 weeks. So in fact, this is another de facto abortion ban. Following the Supreme Court ruling that found that abortion is healthcare and struck down 2 abortion bans in the state, the governor called on the legislature to pass a constitutional amendment to show up on the ballot this coming November. But the Freedom Caucus knows that they would lose at the ballot box because abortion access is popular in Wyoming. Our surveys consistently show that 65 to 70% of Wyomingites support access to abortion, so they know that they would lose at the ballot box. So they are attempting to pass more legislation that will just be tied up in the courts and cost more taxpayer dollars. So I encourage you to reach out to your legislators, ask them to vote no on HB 3, HB 117, and HB 126. We are in favor of HB 4 and HB 64, which would expand Medicaid coverage to include licensed birthing centers and increase reimbursement rates for obstetric care in the state, which would go a long way towards stopping the closure of labor and delivery centers that we're seeing at our hospitals across the state. So here we go. The time for action is now. Reach out initially and then stay tuned for updates on what's happening down in Cheyenne.